So, hello everyone. Before we start today, I want to acknowledge with respect the Indigenous peoples and communities whose historical relationships with the land continue to this day and on whose traditional territories are placed. My name is Autumn Sipis. I am the project coordinator with the Canadian Coalition for Green Healthcare. And on behalf of the coalition, Peach Health Ontario and Cascades, I would like to welcome you to our webinar today, Preparing for Climate Change at Healthcare Facilities, Extreme Heat. This is the third webinar in our Preparing for Climate Change series. If you missed the other two, you can visit our YouTube channel to watch the recording. I'm going to put the link in the chat. And so all future webinars in this series will also be uploaded there. So throughout the webinar today, please use the chat function for any technical issues you may be experiencing. Use the Q&A function. I'll repeat the Q&A function for any questions you have regarding the presentation. Our panelists will be answering questions at the end of the webinar today. We will also be recording this webinar, which will be sent to all registrants. And like I said, it will be available on our YouTube channel as well as our website. So today we are joined by Dr. Myles Sergeant, Dr. Anna Gunz, and Ron Drummond to discuss the topic of extreme heat. I would first like to introduce Myles Sergeant to start off today's presentations. Myles is a family physician who has worked with vulnerable populations, including new immigrants and refugees, people experiencing homelessness and/or addictions, and the elderly over the past 25 years. He is currently the executive director of the coalition, as well as the co-lead and partnerships lead of Peach Health Ontario. I will share your slides, Myles, and you can take it away. Just give me 1 second. All right, are we good?
Almost. Okay, there we are. Excellent. Thank you very much, Autumn, and hello, everybody. I'm going to go camera off here. There we go. Okay, so I am from Hamilton, and I recognize and acknowledge that I am located on the traditional territories of the Mississauga and Haudenosaunee nations and within the lands protected by the Dish with One Spoon Wampum Agreement. Next slide. So, extreme heat is Canada's leading cause of weather-related deaths, and it is not for this reason. This is very important for us to as physicians, let our patients know they need to be careful exercising and working in extreme heat. Next slide. This is the reason why extreme heat is Canada's leading cause of weather-related deaths. And I could almost stop right here to make my point, but I will carry on with the rest of the presentation. This person is indoors. They are elderly. We can imagine that he might have more than one medical condition. Next slide. Some of this I'm sure you've seen before. This is historic data dating back to 1880, looking at how temperature has gone up over the years. This is a number of different groups, all with very, very similar lines. Line particularly going up from 1980 onward. Next slide. This is something I just saw the other day, which is our last year. The blue lines at the bottom are from the 1940s, and then you see the lines that are a bit white are 1980s, and then the 2000s in the kind of the lighter orange. Last year, unfortunately, we had our first year ever. The entire year was over 1.5 degrees Celsius above baseline. Next slide. And then last week, we had the hottest day ever. This is a CNN article that the average temperature worldwide, obviously including the North and South Pole, is 17 degrees Celsius. Next slide. This is an excellent resource. I think it's only about a year old, out of the University of Waterloo and the Intact Center. This is the next few slides are from this. And I invite you to take a look at this excellent piece of work. Next slide. So the risk factors, I really like the way they broke this down. The risk factors for people who are most vulnerable to extreme heat are under three categories here. One, those who have increased exposure to extreme heat. That, of course, includes people living in urban heat islands, people living outdoors, like homeless populations, people living in housing, which is poorly ventilated or cooled, people with mobility issues, people who are socially isolated, people who work in the heat, and people who exercise in the heat. Next category is those with increased sensitivity. Sorry, Autumn, not quite there yet. Increased sensitivity to extreme heat, older adults, infants and young children, pregnant women, people with chronic illnesses, people with mental illness. And I'll skip to the last one. The last group are people with limited access to resources or information, those with low incomes, those experiencing homelessness again, and those who may not speak or understand French or English. Next slide. So this shows the metropolitan areas most exposed to extreme heat across the country. The circle size is the size of the population. So not surprisingly, Southern Ontario has a big circle there, but you can see starting in the west that, Kelowna is highlighted there. Note that Vancouver is not on the list of, and this is looking forward to 2050 to 2080, as you can see in the top right there. But quite a few places across the country. Montreal's another big circle there, Winnipeg. Next slide, please. This is the report to the Chief Coroner of British Columbia. This is some really sobering stuff coming up. I live in Ontario, I don't live in BC, and this may be upsetting to some people in BC who did experience this firsthand. Next slide, please. So this was the forecast for those who saw it leading into the heat dome, and you can see the predicted temperatures the day before the heat dome. Vancouver, not typically 36 degrees. Some of the other towns more inland, incredibly high temperatures over 40 degrees. Next slide. And this is a lecture which happened after the event. I'm just highlighting this point at the bottom, that heat dome, which settled over the Pacific Northwest, obviously not just Canada, at the end of June 2021, was considered a 1 in 1,000 year event. But because of the way our climate is now, it's 150 times more likely to happen. And unfortunately, we can expect to see these sorts of events. Next slide. So I've highlighted some stuff here again from the coroner's report. I'm just going to go through the highlights here. So June 2021, BC had the extreme heat event, which lasted for several days. That's obviously part of the problem. If you, regardless of who you are, the way we cool our bodies, we send blood to our skin. It's kind of like walking slowly, the amount of blood required. And when you need to do this for a few days in a row, you're really asking people to continuously be walking, or the equivalent of walking for days at a time. So they did estimate that in the deaths of that period, 619 were because of extreme heat. And these are some of the reasons why: because of the number of days that this happened, the maximum temperatures which were reached, the fact that people are not accustomed to the heat. It takes a couple of weeks for the human body to become accustomed to heat. The ability of some of the community members to respond to this, and the actions that were taken for those who are most vulnerable. Next slide. I love that they point out that each data point here is an individual life. We need to consider that. These are people who died. Most lacked access to cooler buildings. Most were older adults, you'll see in a second. Many had chronic illnesses. A lot of them did communicate that they were feeling unwell. You will see that 91% of them had at least one chronic disease listed. And 80% of them had 3 or more chronic disease listed. Next slide, please. We have adapted this slide in a couple of ways to sort of make it simpler to read today. And I have highlighted in yellow some of the main chronic illnesses that people had who did die. And again, the reason there are so many numbers here is there are some people who might have had 5 or 6 or 8 of these illnesses. But hypertension, way up there, 71% of the people who died had hypertension, 60% with mood or anxiety disorders, diabetes quite high. I'm having a hard time reading my own slide here. Osteoarthritis was high. Chronic obstructive lung disease, 28%. Chronic kidney disease, 23%. Substance use, 21%. Schizophrenia, 13%. Alzheimer's disease or other dementia, also over 10%. So those are some of the common diseases that were associated with the people who died. Next slide, please. And this is the age of the people who died. Note that no one died under 30, thankfully. Most of the people who died were, as you can see, between 60 and over 90. The reason this is not an exponential graph is, of course, there's not a lot of people in society who are over 90. If this was per capita, per person over 90, that would be a very, very high percentage. But yeah, obviously this impacted the elderly in a big way. Next slide. And finally, this is a very interesting stat. They were not able to find all of the numbers here in terms of number of people who had air conditioning. But you can see there for the people who did not have air conditioning, almost 67% of them. And then there's another 24% that the data was unknown. So even if that's 50% of that group, probably higher, you're looking at 80% of the people did not have air conditioning. Next slide. So going back to this, I'm going to focus on Southern Ontario briefly. As you may know, I'm from Hamilton. Next slide. And I looked up the top 10 Canadian cities that have the most days over 30 degrees Celsius, and was interested to see that it is Kelowna, BC, which certainly was kind of at the heart of that heat dome. Of course, that heat dome geographically was so big that it did include Victoria and Vancouver. But you can see the other cities in Canada that do have a high number of days per year over 30. 4 of these are all in or close to the GTA: St. Catharines, Brantford, Toronto, Hamilton. So you can almost those ones together. Windsor's further west. I wasn't surprised to see that they are very, very high up. One of the southernmost, probably the southernmost city in Canada. A couple in Saskatchewan, and then you've got Winnipeg there as well. And Ottawa, I was a little surprised. I pictured them being a little bit further north. Next slide. This study actually just came out a month ago, done by StatsCan. Major note here, this was data between 2000 and 2020, and they were looking at excess deaths because of heat in Canada. So the point is, this did not include the heat dome we just talked about. This was before that period of time. And they did find that Montreal and Toronto were the 2 biggest in terms of number of deaths above expected because of heat. And their conclusion, or one of the conclusions, was that there was a lower level of air conditioning among people who are renting as opposed to those owning. And they point out that Montreal and Toronto are among Canada's most renter-heavy cities, that tenants are less likely to have air conditioning. So it's something we need to consider. Next slide. This is some things that I show my medical students. This is a lecture I do for the medical students every year. On the left is the Code Red study, which is quite well known in Hamilton. This is now 10 to 15 years old. You do not want to live in the red areas of town, sadly. That is the western tip of Lake Ontario in blue. Of course, Hamilton goes around the tip there. You can see on the extreme left in green, that is the leafy parts of town. People in that part of town live to over 79 years old. Just to the right of that, the north end of Hamilton in red there, the industrial area, people live to about 74. There's a 5-year difference. DeLuca looked at this. He's a McMaster prof and found that poverty, education, socioeconomic status explained much of the differences, but not all. I think there's as much as 40% they could not explain. So I've reached out to him. We are now looking at how this lines up with a heat map and with vegetation maps. And if you squint your eyes, that's how I do science. Squint your eyes and take a look at these two maps and see if there's a link there in the red area. So we are going to look into this, and it looks to me that this is one of the factors. Obviously, lots of confounding factors. Next study. So the point is, and you're seeing this around the world, you don't want to live in the hot parts of town. This is the number of hot days traditionally in Hamilton. The green line is the historic average, which is around 9 days per year. That goes back to the 1970s and 80s. But you can see there's some very hot years that we've had with over 35 days in the summer, over 30 degrees. When I just think back to the hottest periods that I remember in Hamilton, I think back to 2020, which is one of the bars there where we had what I remember being 7 or 8 days in a row over 30. Next slide. So I did actually go back and look at this from some government data. This is July 1st to 10th. Those are the days listed on the far left there. This is the maximum temperature in Hamilton for those days. And you can see that most of the days are over 30, nothing over 35. I think that's a key thing. The point is we did not have a big increase in deaths in that period. Another reason why is not only did we not go over 35, but also look at the minimum temperature. That is a key point here. There was only one day that was over 21 at night. One night dropped right down to 12 degrees. That is a key point for elderly people and people with chronic medical conditions, is that your unit cools down at night. Next slide. The beaches were very popular during that period. You need to think about where you can go to cool off. Next slide. So Anna, I think, is going to get into more of this, but what I point out to people, our body temperatures are 37 degrees at baseline. So when the outdoor temperature is getting, or the temperature in your apartment for that matter, is getting over 30, you have less ability to cool off. So then you start to sweat. If it's humid, you cannot do evaporative cooling effectively, and then you start running into trouble. Next slide. I found this one interesting. This is 10 years old. This from 10 years ago pointed out many of the same things I'm saying today, much more obvious today. Excessive heat is considered the silent killer because people are dying in their homes, in their apartments, and it doesn't get the media the way the young football player with all his equipment on getting overtrained in the heat. That's what we think about when we think about people dying of excess heat. We think about athletes, but it is the people who are living in an overheated place and don't have access to cool dwellings. And I'm going to pass it over here. Sorry, it's such a somber topic. Thank you very much, everybody.
Thank you, Myles. Oh my God. Okay, so next up we have, I would now introduce Dr. Anna Gunz, who is a pediatrician founding medical director of the Children's Environmental Health Clinic Ontario, and clinical lead for planetary health and sustainability at Children's Hospital London Health Sciences Centre, and associate professor at Schulich School of Medicine and Dentistry, Western University. Currently, she is working on various advocacy and research endeavors in the field of planetary health, including health monitoring, mobilizing knowledge for action, and promoting the holistic benefit of nature with the land-based healing program. Take it away, Anna.
Thank you. I'm in a very strange situation where my slides are way lower. So if I bring down, that is why. I will try to look at you guys though. So thank you very much for this opportunity. It gives me great joy to be here today. So I am going to talk a little bit more about us as individuals, as patients, and again, get to the surge planning and implications for the healthcare system. And if you hear shuffling behind you, I have some bunnies / composters who have joined me for this presentation. But first, I would like you to take a minute or 30 seconds to just think about yourself. Think about, it might be really hot outside, maybe you're outside right now, but just take a minute to think about how you feel when it's really hot. Imagine yourself there and think from a full body, mind, emotions, body, spirit. How do you feel in the extreme heat? Some people feel joy, some people love it, and others don't. And I'm just going to pause for a second while I'll give you an opportunity to do that. Now, this is the interactive portion. So have a look, with that in mind and with your prior knowledge, have a look at this scenario here and pretend it's like 37 degrees in the city. How many health threats, if you're using a lens where you're looking at health threats, how many do you identify from looking at this that are related to extreme heat? And if we can, if we're able to put it in the chat, it would be wonderful if you could just give us a number. Some very brave people. You don't want to put it in the chat, we'll leave it. Oh, there we go, 4 to 5. And if you don't want to display your answer, just have a think, but definitely count. And we'll come back to this later, because what I'm hoping is when you look at it, when we're going to do is we're going to put our green eyes on, we're going to put our green goggles on, our magnifying glass, and hopefully we will see, we'll have when we use those, we'll have a different sense of how we look at these pieces. Sorry, there's a delay with my slides. But before I do that, I just want to tell a story. It is a very sad story. So if you feel you're going to be triggered or you're not having a good day, I invite you to just put me on mute for a second. And when I go to the next slide, please join. So this is a story that I tell. If you've heard me speak before, you may have heard it already. But this story is about a boy called Joseph. And Joseph was a healthy 10-year-old boy. And he was out playing with his friends on a really hot and humid day for that time of year. And they were playing on the grass, they were playing sports, and all of a sudden he dropped to the ground. Thankfully, there were adults around. They started bystander CPR, EMS was called. They brought him to the hospital after about 30 minutes, and eventually they were able to restart his, get a heart rate back. But unfortunately, he had sustained devastating neurological injuries, and it was clear that if he was going to survive, he would never be the same. And I met the mother about an hour after he had come to the hospital. And at this point, we knew that the cause of his death or his arrest was asthma. And when I told his mother that was the cause of this injury, this accident, her first words out of her mouth was she paused and she went, "Oh, it was really humid out today." And that gives me, every time I tell it, you'll hear me say the same thing, it gives me chills, because it never, and I've been in and out of the ICU, pediatric ICU for about 15 years, I've never heard a parent in the worst moment of their life tie their child's illness to the weather. And the reason I tell the story is because, and I'll move to the next slide, is because that mother believes strongly that it was affected, that his ultimate death was associated, that asthma attack was associated with the heat and the humidity, that he was a victim of climate change, and she never wants another child to suffer like that. So that's why I tell that story. So jumping in, Myles talked a little bit about death, and you can see that it's multi-system. And so I just want to give you a bit of a perspective of how to think about this, because when we're just talking about extreme heat, even though we're just talking about extreme heat, all of these other factors are going to affect and influence these statistics and the humans that are suffering and the cause of these deaths. So this is the way I like to think about all of these different environmental threats, including extreme heat. Each one individually has an impact on our health. And then each of those threats as well has an effect on these, what I call health modifiers, there's other words for it, and malnutrition and displacement. And malnutrition is especially important when we're talking about heat, because there are a lot of reasons. Heat can be associated with drought, growing, using extra resources. Obviously, there's a lot of that, but even 1 degree of temperature decreases the macro and micronutrients of food that is growing, which can then we bring into the system as things are getting hotter. And each of those events, as well as these sort of magnifiers, as well can impact your mental health, and all of them can interact together. So when we're talking about the mental health impacts of extreme heat, it's not just the impact of it being hot, but it gets a little bit more complex. And then he talked about people who are more susceptible to heat. And this is where I come back to again. And what I hope to highlight is some of the reasons why people have increased susceptibility or burden of these events, including extreme heat, has to do with the things that Myles was talking about in terms of their mobility, about where they live, the environments that they're in, and the healthcare they can receive, and medical complexities they have, as well as the extremes of age. And so this just says children, because I realized I took it from a presentation. I was just speaking about children, but seniors as well. So when we think about the actual impact, what's happening to our body, as Dr. Sergeant has commented, as your body increases and gets more hot, you have these things that your body does physiologically to try and cool you off, such as vasodilate your skin, so you have more blood flowing there, and hopefully you're sweating so that you can cool. It also, a lot of the time, people change their behavior in heat, right? So they go outside, they might be wearing more sun exposure, so their retinas and their eyes are getting more sun exposure, as well as their skin, which can lead to burns, but also thinking about skin cancers and damage to skin that can happen, as well as things like macular degeneration and other risk factors that people will generate with time. They also, if you're trying to continue to do strenuous activities in the heat, or you have a complex medical illness, that means that your body is already on strain. You are going to feel the heat more, because we know that people's cardiac output, the amount of blood that you have to circulate to your body, already increases when you're hot in order to prepare these mechanisms. And in addition to that, when you're very hot, it also causes an inflammatory reaction in our circulatory system, in our blood system. And when we have inflammation in our body, it can lead to sort of multi-system damage and injury. So the one piece that I really want to bring home here is it's not just about heat stroke that we're talking about, or heat stress, although that is extremely important. And the piece that I want to make sure I continue to mention, one of the problems in the system about heat stroke is, man, can it look identical to sepsis and other infections. So we can have delayed diagnoses. And if you don't believe me, I actually run a simulation in the extreme heat the other day for our emergency residents and fellows and in ICU fellows, and not everyone treated it like sepsis and no one thought of heat stroke. So I've heard of colleagues say that, when the merge were the barometers, but I don't think we always remember what happens outside before that. But it's a lot more complicated. So I'm going to run through quickly in the next just 4 minutes, a little bit about what kind of, just give you an overview of what kinds of a burden of illness and strain on our healthcare system and what we provide when it comes to heat. This book that I have here, the PAHO for healthcare professionals, is an amazing pocket guide. It was written by physicians who are mainly actually in the Southern and Central America. PAHO is a Pan American Health Organization affiliated with WHO, and they went through the literature and they talk about it's organized by body system. It's a free download. It's meant for physicians, so you can understand by system how the different climate events can affect you. And so every chapter, there's a chapter on heat, including lists of medications you need to think about. So amazing resource. But when we're talking about what we know about the health effects, there's a few things to keep in mind. First of all, is what we talk about, what we've measured in the literature is just what we know now. It will change with time, and it will also change with observation. So as we sort of make more observations and links and we query about some of the different health effects, we're going to start saying that extreme heat is related to a lot of other conditions as well. And so this involves some diagnostic scrutiny on our part to really think about this. So when I think of extreme heat and any climate event, I always think of the obvious versus the occult. We have to think about surge planning. We're going to have expanded differentials. That's going to cause referral pressures and system and capacity issues. So what do I mean by obvious and occult? So there's some obvious things that happen when it's hot, like people might get sunburned or they might get dehydrated and then have electrolyte disorder. And then they might present with heat stress or heat stroke, which involves when you actually have neurological changes on top of having an elevated body temperature, you need immediate cooling. And so an example of this, and I'll keep going. But the other thing that happens is there's a complex other healthcare conditions that either can present at the time, so including out of hospital cardiac arrest for all-cause mortality, which Myles has touched on, but also things like MIs, heart attacks, strokes, as well as pneumonia. There's more people who present to the adult and the pediatric emergency room. And this is a study that we did that showed that not only does it increase the number of visits to emergency room when it's heat for infectious and respiratory issues, that's all we did in children, this was Southwestern Ontario, but it continues for 7 days. So it's not just on the day that this happens, it's the days after that. And so, and this was we looked at children, but the adult data is much the same. When we looked at our critical care data for adults and children, it also looks like there's a trend about 33 degrees where you get more people just coming into the critical care and being admitted, more pneumonia, and more respiratory illnesses and asthma, as well as infectious diseases like and gastrointestinal diseases and things like Coxsackie disease and etc. So when we had the extreme heat in Southwestern Ontario a few weeks ago, I was sitting in the soccer just after it all paused, and I said to a comment to my friend whose son's a very elite baseball player, and they played out in Windsor when it was 40 degrees. This baseball tournament that these boys played, and she kept saying, I can't believe they made it through the game. The organizer of that tournament is a woman who is now an elderly, who organizes that tournament in honor of her son who died, and he loved baseball. She, one of the people in the stands, that, and this is in relation to the cause of this tournament was so well-meaning and so important for this. During this tournament in that extreme heat, someone actually went to the emergency department with heat stroke. And so there was this story of the fans getting around and seeing this person who was almost was fainting and passing out and delirious and not being able to speak well. And what were they able to do? Now they were able to make it to the next day. So this very important tournament. And I looked at her and I said, oh, all those boys are going to be sick next week. And she said, really? All those boys were sick next week, as well were all of our kids. And we had this huge surge in respiratory viruses. And in the pediatric, we were surging like crazy, like we do every July with all sorts of infectious diseases. The other thing that we know is, it can affect people at the very extreme. So heat is associated with preterm baby birth, low birth weight, as well as stillbirth. And this is a meta-analysis that was done that looked at exposure to air pollution. And this is a really important point because air quality and heat are intrinsically linked. The air quality gets worse as it gets heat, gets into secondary creation of pollutants like ozone. And also, there's extra stress on the body. So we know this. From a mental health perspective, there are many ways that the environment and heat and all of these pieces might interact to affect someone's mental health. So specifically with heat, this is a global study that looked at there's more countries that are on this slide, and they looked at suicide rates. And they found a global threshold, no matter what climate you come from, of 27 degrees, where people, where suicidality suicidality increases. And that's true in Canada for women, men, the young, and the elderly. So what happens with heat? Heat can increase anxiety and stress. It can cause sleep disturbance and fatigue. And this is where the nighttime temperatures are important. It can cause agitation and irritability. For people who have pre-existing mental illness, it is a much higher risk of exacerbation of those pieces, as well as aggression and violence. And so we have to think about who are those pieces as well. In addition, when people have access to air conditioning, they might be isolating themselves and create loneliness. And this is really important. There's some slides I have later. We actually interviewed patients with families who have complex medical illnesses, and they talk about isolation and loneliness is a big issue here, as well as the institutions that they go to not necessarily having air conditioning and ability to cool. And when we think about cooling shelters and the public health measures that we do, giving water bottles and cooling shelters, not everyone is going to be able to go to those areas. Not all of them are going to be safe, and not all of them are going to want to. I threw the slide in about epilepsy syndromes and the question about the relationship with heat, just to give you an example of, as people look at their own purview and where they are in medicine, we can see trends with heat and different illnesses. The other big piece here is medications. So there are a number of classes of medications that can impair people's heat response, alter how they are with heat, or impact their ability to adapt to heat. And so we really have an obligation to create heat plans in terms of what happens when you're prescribing diuretics. Do you have a heat plan? Any cardiac meds or beta blockers? Are you advising them about the effects with heat? Are you changing the medications? And any psychiatric and medications also have something that can be affected by extreme heat. So really important conversation to have. So I'm just going to move now. The final 2 points I want to make is, number one is this girl here, Ella, who is this beautiful girl. She made headlines in 2022 because the coroner, so she was this girl who, her and her mom tried to control her asthma as hard as they could, but ultimately she died of asthma. But the coroner, when he looked at the death certificate, he put that the cause of her death was air pollution. And that is the other piece that I really want to make is, why is this so important? Because when we're looking at how this is affecting us and how it's affecting people, we're being asked now to make sure we're including heat-related illnesses and making sure we're marking them when we're diagnosing those of us who are clinicians. However, I want to talk about that's very difficult at an individual level, because it's not just about heat stroke and heat stress. Is that person who is having a heart attack today, is it related to heat? Is that worsening of this person's COPD, is that related to heat? Is this child coming in a week later with influenza, is that related to heat? It's really hard for us to say. So I'm just going to give you a second to cool with that little bit. But in terms of what we need to do, so hot day plans are really something we need to think about. So do we have a list of contacts and people that with our patients who are vulnerable in heat? Do we know about the community services they're connected on, or the people who can talk to them? Do we know if they have ways to cool themselves? What are their barriers to cooling? Blackouts increase when there is a heat wave. So do we talk about that? Do we talk about water supply? What about people in apartments who can't open windows and might have decreased mobility? Are they able to get out? Are they able to cool? Skin and eye safety, I feel like it's taken a back burner, especially amongst children and child health. These days, we need hot day plans and where people are, cooling shelters and green space, maternal cooling beds, and drug plans for patients. And at a system level, we need surge planning. I can tell you I work in different hospital systems and transport organizations. This concept that we surge in heat is very challenging. It calls our ability and our susceptibility to heat planning as well. Heat safety for our first responders and workers is also really important, as well as education around in the pre-hospital experience. When we have patients that are coming in en masse and coming in from 30 minutes away with heat stroke that's looking like sepsis, do our medics recognize that? Are we starting cooling? And in a similar way, what happens when there's masses of people? So in the Northwest, when there was that massive heat wave that came through, they ran out of cooling measures. So then a doctor who worked in the South was like, we can get body bags from the morgue. And they got body bags and filled them with ice, and that's how they cooled them. But that had someone who had an experience in that environment in order to care it. So I am going to end there. I realize at time now, but I just giving you a second to look at that picture one more time. And I'm just curious, for you personally, if your number has changed, do you see things, different things now in this hot day or not? And thank you once again.
Thank you so much, Anna. So next up here, I would like to introduce our final speaker, Ron Drummond. Ron is the Executive Director of Capital Projects and Facilities Management for the Ottawa Hospital, where he leverages his passion for energy management and people-centered leadership to help drive positive patient outcomes by increasing hospital infrastructure resiliency, sustainability, and environmental performance. Take it away, Ron.
Autumn, just give me a thumbs up if you can see the presentation.
Yep, I can.
Fantastic. All right. Yes, Ron Drummond, the Ottawa Hospital mechanical engineer, and I'm the Executive Director of Capital Project and Facilities at the Ottawa Hospital. Nothing to disclose other than I'm very excited to talk to you people about preventative maintenance and its implications with extreme heat. At the end of this session, attendees will be able to recognize several factors that can affect a facility's ability to control thermostatic conditions due to that extreme heat. I'm also hoping that you'll be able to list some mitigating measures that you can take to reduce the risk posed by extreme heat. And finally, hopefully take back with you a methodology to help formulate practical plans to mitigate the effects of extreme heat in your facility. First, we'll talk about the background, really short because my previous two presenters have done a great job about it. So background on extreme heat, we'll ask you if you know your cooling system or HVAC system, and then we'll talk about many factors that can affect cooling performance. So climate change does impact everything around us, our health, our safety, our infrastructure, our economy, and our environment. The table at the right demonstrates the impact of climate change on the city of Ottawa between 2051 and 2080. What I'd like to draw your attention to is the large swing in the hottest temperature in the top line there, 42.4 degrees Celsius, and moreover, the projected six-fold increase in the number of days over 30 degrees Celsius. Also interesting in this table, I find, is the increase in rainfall, so those huge storms that we're seeing right now, and the decrease in nights that are going to be cool. One of the great saving graces right now is that our nights are still cool, so we're able to cool down healthcare facilities naturally. As we go on into this century, that's no longer going to be the case. So in short, our reality 50 years from now is going to be much different from today. All of our infrastructure built today, roads, building, pipes, etc., weren't designed for this kind of climatic condition. So it's imperative upon us to take the actions today to make sure that the future infrastructure can handle these situations. So I came to facilities management and healthcare from managing large building portfolios and delivering projects primarily in commercial industrial settings. So it was a little bit of a shock, safe to say, that entering the healthcare, that it was like not your run-of-the-mill commercial building, not at all. Of course, we've got common areas between commercial and institutional. We've got common areas, public washrooms that are pretty typical, but overall, healthcare is far more complex, and we typically serve higher risk situations and our populations. We've got specialized cooling in healthcare. We have ORs that we have to maintain, diagnostic imaging that relies on a cooling medium, laboratories where all that research happened that relies on our ability to maintain both temperature and humidity. I'm thinking about pharmacies especially. And food services require that cooling to be able to prepare and deliver food to our affected patient population. So what I've tried to show here is how cooling is delivered throughout our hospital at a pretty high level. And that includes, where it's generated and how it gets transported through the hospital. And this sort of arrangement is typical of any, medium to large side hospital. On the right is a screenshot of our building automation system that shows the various components. So we have centralized or standalone chillers. Typically, those are those elements in the middle. They produce the cooling. And on top, at the top left of the diagram is what's called a cooling tower. The cooling tower rejects all the heat. It's one of those laws, right? If you're producing cooling somewhere, heat has to get rejected somewhere else. So the chillers produce the chilling, and the cooling tower releases the heat, and everything in between sort of connects that cooling medium with the cooling users. So in healthcare, you'll have ventilation units that require it for either cooling or dehumidification or both. Medical equipment, IT rooms. Every occupied area of the hospital requires that cooling. diagnostic imaging, labs, food services. ITIS is an emerging one that keeps on imposing more and more load on the system, our patient wards, many others. So in terms of the quality of the cooling medium being provided, there's a number of external and internal factors that can affect the thermostatic conditions within your facility. Externally speaking, the condition of the device or the materials protecting the device could be in need of repair. Also, location could be a factor. If a unit is located too close to a wall, it might not have enough air space around it to maintain its performance level. Internally, there are many factors that affect cooling systems. I can speak on the healthcare systems I've worked in. The cooling system age is a primary one. Most of the systems that I deal with today are 40 to 50 years old and are showing their age and are showing their a drop in efficiency because of that age. The quality of the cooling water or fluid is also of paramount concern. If it's not at its purest, it can affect the system efficiency. And there's failed infrastructure within many of these systems that are difficult to get ahead of. So we're going to talk a little about reducing risk right now. So I guess the three questions that I ask myself is, how do we reduce the risk to patients, knowing that lots of our systems are aging, the demand in our systems is increasing with the primarily with the addition of new technology or new research being installed in healthcare spaces, and these extreme heat events are likely going to intensify in magnitude and duration as we go forth in the century. So I try to break it down into three different areas to try to reduce risk. One is preventative maintenance. The second is the fluid quality and temperature. And finally, a load shedding plan. So first off is preventative maintenance. So regular inspections, cleaning, and monitoring of essential components such as chillers, evaporators, cooling towers, etc., will not only reduce operational costs, but also ensure a comfortable and controlled environment for your facility. It's best to have these inspections occur as part of a comprehensive maintenance program, which, if followed, should prevent you from having premature breakdowns and the inherent expensive costs that come with those urgent repairs. One thing that I think I've really seen in the last, I'd say 5 years, is that climate change is extending our cooling season. And what this means is that we have less and less time to do those major seasonal maintenance activities to ensure that our systems, once the springtime rolls around, is able to go into action. The other thing that is a little bit of concern for my teams, and I hear it a lot, especially in this last year, is we need to drain down much of our system during the winter to prevent freezing in our systems. When we get those warm Februaries or warm March days, we know our ORs are going to be struggling, and we often have to refill coils, which is a very time-consuming thing to refill the coils and get them operating properly. The other impact with that is that those warm days in February are often followed by a freezing day in February. So it's often this push-pull of loading coils up and draining coils down, which can consume an entire department's manpower. So those 5 pictures at right, the chillers, cooling towers, filtration, insulation, and startup issues, I'll break those down each for you on the next couple of slides. Just trying to identify some things that you can do within those 5 areas to try to make sure your system is working at its optimum. So in terms of chillers, it's just super important to address minor problems promptly, because it'll prevent you from having to escalate those minor problems into major system malfunctions that can really disrupt not only your cooling system, but also your ability to operate your healthcare facility. So routine checks for your refrigerant levels, the water quality, compressor operation, and condenser cleanliness, all part of your comprehensive maintenance plan, or at least it should be. One thing that we do on an annual basis here is vibration analysis. So all these chillers essentially have rotating parts, and those rotating parts, if they're not operating to spec, will vibrate a little bit, and that vibration can cause misalignment or bearing defects. It can cause oil leaks. It can cause the chiller to seize entirely. So it's it is imperative that that those things are dealt with on an annual basis. And what it will do as well is provide you a trend line of how your system's operating over time. So those deficiencies can be tracked and reacted to in a proactive rather than a reactive basis. An expensive thing to do is an overhaul of large chillers. These should be done at regular intervals. We have a number of different types of chillers within the within the hospital. Trane is one company that does provide a majority of our cooling here, and they recommend that every 40,000 hours of operation that a chiller be overhauled to ensure that it's operating at its prime level, and that any dirt, imperfections, etc., can be captured at that time rather than a catastrophic failure. And the last thing I want to underline here is for your chilling operations, have a contingency plan. Make sure you have agreements with chiller rental companies in place. So if and when a failure does happen on your hottest day, you're only 2 to 4 hours away from having a temporary chiller show up at your doorstep that you can connect into your system. This will mean, if you want to have it done quickly, that you should make preparation within your facility to accept one of these rental trailers from showing up, having them being able to plug and play essentially into your electrical system and into your chilled water network. Sorry, next slide. Here we go. The cooling tower. So sort of the yin and the yang of the chiller. So if the chiller is producing cold, the cooling tower is rejecting that heat. And maintaining the efficiency of their cooling tower is key. You only get as much chilling out of your chiller as the amount of heat that your cooling tower can reject. So it's important to keep it operating at its peak efficiency. Some of the ways to do this: repair the leaks in your cooling tower promptly. Every ounce of water that you inject into a cooling tower's network tends to blend down the temperature of that water, which will affect the chiller's ability to deliver the temperature water it needs to provide to the healthcare facility. Make sure you clean your tower regularly to prevent blockages. A blocked system is never a good thing. Cooling towers are exposed to the outdoors, so there's like lots of environmental effects that happen with that. So they'll often develop algae if you don't chemically treat them. Bleach, that sort of thing needs to be added to the system to prevent that algae growth. That algae growth is not a great thing to have. One, it affects the efficiency of your unit, and two, that algae will eventually make it into your pipes and whatnot, causing problems downstream of the cooling tower. One thing that I've noticed throughout my career is the fact that some cooling towers are not designed quite correctly, or sometimes pumps are oversized. And what often happens then is that the tower will eventually create a vortex and start sucking air right into the water circuit. And this dramatically reduces the performance of your system. And it can really play havoc with the downstream equipment. Air in a water system is not great for pumps. It causes cavitation, loss of pumping power, etc. One thing that you can do in order to break a vortex is what's called a vortex breaker. That's shown sort of out right there. They come in many forms. You got a cross one shown here. And what that does is it breaks up that vortex and allows the piping system to remain full of water, not full of water and air. Lastly, with your cooling tower, you do want to make sure that at winterization, any water that you have in the system is protected from freezing. So make sure your heat trace systems are working. Make sure your cooling tower basin heaters are functional, or else you could be left with a really, really sad state of affairs in springtime when you have breakages of either the basin or in your piping. Filters. Sometimes like the easiest thing is the most forgotten thing. Filters are used in ventilation units to remove debris. I think we all sort of recognize what filters do. We have them in our furnaces at home. The ventilation units that we see in hospitals are just 20 or 30 times the size of that, and the number of filters we see is also much greater than that. The filter removes that particulate matter from the air and also protects the internals. So that's the internal coils that produce the cooling and our ductwork from becoming encumbered with dirt or dust. The big problem is if filters are forgotten is that eventually they create a static load on the fan systems that are there. And it can lead to a number of different issues. One can be overloaded motors that become like the motors have to work harder and harder and harder in order to overcome that static pressure that the dirty filter provides. This will result in reduced airflow, which is not a good thing. It could result in icing refrigeration coils and ultimately motor failure. And I'll let you know just a quick story, because I know there's not a whole lot of time left in this presentation. But one of my first days in my former hospital, I was invited to go to a retirement home who had complained that their systems weren't working anymore. And I went onto the roof there, and the filters that were there had over an inch of dust on them. And that was what caused the no flow condition at that point, and other units had actually failed completely. So motors had failed because the filters weren't changed on a regular basis. I recommend that your filters are replaced at least quarterly. And one thing, especially if you're in a place that's in close proximity to the to forests and whatnot, you might have to do it a couple times in the spring after the pollination occurs. That pollination will just stick on your filters and stick on your coils for your condensing units. And I try to show it right what a dirty condensing unit can look like after that pollination period has occurred. Insulation, much like filters, often overlooked, but a properly insulated piping system will greatly lessen the energy demand on the system. Piping installation doesn't seem like a big thing, but insulation does help maintain systems performing at their highest level. If compromised, the cold piping insulation protects the cold piping insulation that protects the piping will come into contact with the warm air and it'll lose some of its energy. It'll also cause some condensation on the pipe. And losing that condensation control can otherwise corrode the exterior of the piping. It can also soak the equipment and surfaces underneath. And soaked insulation will eventually lessen the performance of the insulation. It'll also eventually start growing mold, which is also nasty to have in healthcare. So when you're looking out for issues with insulation, what I want you to keep your eyes peeled for is missing, damaged, walked on, and broken insulation. And when you say walked on, like how do people walk on these things? Oftentimes on the rooftops, people will use the piping insulation as a ladder of sorts to get over different sections. Frankly speaking, I've used I've used pipes to climb over when it's been required. So it's it does have its impact, and what you'll end up having is a pipe insulation, what you see out right there. So other things to look out for in terms of damage insulation, look for that water on the ground, dripping pipes, discoloration in a mechanical room, discoloration on ceiling tiles sometimes can be an indicator of poor insulation. You might also see some crystallization on the outside of the surface that would lead you to believe that there's some problems with the insulation. So if and where you can, make sure that your insulation is intact, especially for those systems that have refrigerant piping that are on roofs. The UV from the sun can really degrade that black insulation. And that's when I try to show that left there in the left picture, refrigerant line insulation. Startup issues. So here at the TOH Miniverse systems, we winterize. So we drain down the coils during the winter time, and in the spring, we fill them back up. One thing that might happen is that if is a burst cooling coil shown out left in the picture. So if water wasn't drained down and blown out from those systems during shutdown, it's quite possible that the cold winter air would have frozen the coil and burst the pipe. So do look out for that in the springtime, and do make sure you winterize properly. Airlock is the other thing that comes with refilling pipes. So airlock is a condition where, if you have an empty pipe and you fill it back up with water, there's going to be air in the system. And if you don't have air vents on them, and I showed the air vent circled in green in the photo to the right, if that air vent isn't open, you're not going to bleed the air out of the system. If there are other devices you can use to it, but these are primarily what you will use. And that air does need to be bled at the high point of the systems. And those high points typically are going to be at your air handling systems located at the roof level or in the penthouse at the very top of the coil. So do make sure that when you are putting a system into operation, that you bleed the air, and likely you'll have to come back at a later time once the air begins to amass together and do the exercise again. What that airlock can do is eventually reduce the flow or stop the flow completely from going through a coil, in which case you would have no cooling. So second point here is fluid quality and temperature. In terms of air quality and temperature, CSA Z317.2 Table 1, which is shown to the right, spells out the requirements for conditioned spaces in healthcare facilities. The cooling energy produced should be sufficient enough to meet these standards. However, if the quality of the medium alters from design, it can have a negative effect on cooling performance. So three ideas to look for here. One, in terms of fluids that can be used, we'll often find in our northern climate that we use glycol water solutions. These solutions provide great freeze protection to systems seeing large amount of fresh air from the winter. but these systems should be validated for the glycol percentage. Oftentimes, you'll find that building operators will top up the glycol system and will end up with using more glycol than what is required. And the more glycol you use, the less efficient the system actually becomes. So make sure you're doing your glycol test to ensure that those things are working as per spec, getting the most out of your system as possible. Secondly is the installation of two-way valves in lieu of three-way valves. So a three-way valve is something you see oftentimes at a ventilation unit, and it'll bypass a little bit of that chilled water back to the chiller just to maintain what is required of the unit. It's kind of a waste of energy, and what we're seeing a trend towards now is replacing those units with a two-way valve. And the two-way valve basically lets chilled water in or no chilled water, and it ranges from 0 to 100%. In order for that to be effective, you need to have a variable flow system, but we are seeing like large energy savings in two-way valve applications, and it does allow you to improve the overall cooling system performance by installing these types of controllers. And lastly is going to be your chemical treatment. So regular water quality testing is paramount to make sure that your systems are not scaling or building up mineral deposits on either your pipes or your equipment. Any deposit on any heat transfer service reduces the amount of heat that can be transferred in that system. So that regular testing and that regular adjustment is needed. Lastly, I'll talk about a load shedding plan. So at rate, I've shown one of our floors here at TOH, and it's showing you exactly where our air handling systems are serving on this particular floor. It's really important that to have an effective load shedding plan that you know your HVAC system. So if you haven't done this layout yet, please do, so you understand where you can shed energy from. Those decisions should be made by a multidisciplinary team within your hospital. So here at TOH, we work with our infection control people, our clinical people to determine which areas that we can let stray a little bit to prioritize other areas. And that goes back to table 1 from CSA's Edgar 317.2 that dictates for us what those levels actually have to be. Your MDT is going to identify the areas where cooling can be prioritized and where we can tolerate a little bit of temperature or humidity swings. Often those will be your administrative areas, your corridors. On a particular warm spell, you might even want to have people work from home in those admin areas so you can go even further. Again, specific areas require specific measures, and ZED 317.2 is your pathway for success for there. At rate, I've summarized what I've said sort of in a flow chart to describe those steps you need to go through in order to establish a load shedding plan. But some of the strategies that could be considered includes raising the space temperature within certain areas, requiring less cooling, obviously. You can raise the leaving supply air temperature coming out of your air vents. You can modulate or close chilled water valves, reduce the amount of fresh air you're bringing into your building, slow air handling units, or completely shut them off. What's really important is that your facility staff who maintain control over these systems are trained and know how to react when they must load shed. It goes for the same thing for electrical systems. When we have electrical brownouts, we have a load shedding plan for electrical, what areas can be sacrificed, and we have a load shedding plan for our mechanical systems when cooling is paramount. So last couple slides here. Some guidance and other considerations. So I really want to stress this: do not take your cooling system for granted. I was in Boston this last weekend, birthplace of Ben Franklin, and I saw this quote: "An ounce of prevention is worth a pound of cure," and it really is apt here. So make sure that you have access to the spare parts that are crucial for returning equipment back into service. That might be control boards for your chillers, pump motors, spare compressors, etc. Make sure you have those standing by so you can quickly react to a downtime. Make sure that you have good relationships with qualified contractors or suppliers who can mobilize quickly to either repair or replace equipment. And again, contracts should be in place with rental companies for both chillers and generators to make sure your hospital or healthcare facility can get back up and running within hours of an incident. Future planning, big thing. So we know that's getting hotter. We know it's getting more humid. We want to make sure that when we're replacing equipment, we have those opportunities to upgrade our facilities. We're going to consider designing systems for the future condition. Right now, the Ottawa Hospital is designing a new campus, and we're using climate adjusted conditions for 2080 in sizing our equipment that's going to be going in on day 1. Renovations in existing facilities might require larger piping, coils, or pumping power to deal with increasing temperatures. So try not to limit your scope to just that one piece of equipment when there's all those ancillaries that might have to be increased at the same time if we want those systems to be functional and operational in 2050 and not just in 2030. And lastly, there's some really simple things that we can do to help reduce heat gain at renewal time. So consider using those technologies or products that are out there right now. There's reflective roof coatings, reflective coatings for roofs, window tinting, improved building envelopes, so fixing our sealants, improving our glazing, and increasing the R factor on our exterior panels. Reference material, three things I have here. One is that standard for the special requirements for HVAC and healthcare facilities. That's CSA Z317.2 2019. If you don't have a copy, get a copy. It's the Bible for facilities operations. And then two other interesting things that were put to me, one from Health Canada, which is a checklist for healthcare and healthcare facility managers. And the World Health Organization also has a checklist there to help assess vulnerabilities in healthcare facilities with the impending changes to our climate. Many thanks.
Thank you so much, Ron. So much great information being put out today in this webinar. We have gone 6 minutes over time, so I apologize to everyone, but I think if Ron and Anna, you guys are able to stay a few minutes later, we can answer the questions that have come in and any more, and then we'll be able to send out the recording if anybody needs to leave. Okay, let's see what we have in the chat. So yeah, everybody, please submit your questions in the chat or in the Q&A, and we'll go through them now. Okay. So it looks like we have a couple different ones in the chat. First one from Samantha Green says, I'm curious about higher level retrofits. Are you looking at green roof installation or increasing tree planting or other passive cooling interventions? I saw the recent federal retrofit money is potentially open for hospitals. So I believe that one was for you, Ron.
Yeah, we're looking at all avenues to try to reduce our environmental impact. So that includes the very straightforward things like improving the amount of trees that we have at our campuses. So at the Journal campus, Journal campus is an interesting campus because we have two other partners there. We're the Children's Hospital there and the University of Ottawa. And any submissions we're making to the city right now that causes us to have a new facility, we're also getting increased tree planting that comes along with it. So U Ottawa is building a new building, and they've got dozens and dozens of new trees that are going in as part of it. And we're also looking at trying to improve our landscape standards so that we understand that when we take a tree out, we're putting a number of trees back in of a certain width at breadth height. So we're trying to follow the best practices for our landscape. And in terms of building envelope, we are doing a project right now at the Journal campus where we are improving our the sealants between the concrete panels. Our roofs are being designed with more R value to them, and as well as our exterior cladding.
Yeah, it seems like a lot of, new buildings are making it a big priority to actually, implement these things from the start. And then we see updates happening all the time. Lisa, I see you raised your hand. If you want to speak, I can let you speak. Allowed to talk. Go ahead, Lisa. Maybe not. Okay, and Samantha had another follow-up question, and it was like, she said she's also wondering about hospitals' roles in providing cooling to neighbors, the anchor institution role during extreme heat. Should we all open up our lobbies in cafeterias, for example?
So I think that's a nice idea. The one thing we have to understand, like during those episodes of extreme heat, are also some of the busiest times for us in healthcare. That's the times when our ERs are their most full, and we're full already. But during those periods, hospitals are a really, really tough place to be in, period. It affects our ability to get people through the through the system, really. I think the cities are doing a better job of it. I know the city of Ottawa opens up some of their spaces during those extreme events for our populations that are most vulnerable. So the homeless, et cetera. I think the knowledge is there from this. It's a city issue. If you absolutely need some reprieve, I guess healthcare is somewhere to go, but I would try to reach out to find out with the city where those areas should be before you overrun the healthcare system.
Yeah, I think, the hospital's number one focus is patients first. And I do think there's a lot of opportunities within communities to allow for cool spaces. And I mean, for example, with the smoke and the Yukon, creating clean air shelters. So there's definitely a lot of innovations that can happen. Okay, so we have a question from Sejal. Said, from a mitigation standpoint, can you comment on the role of retrofitting these systems to run on renewable energy? Is it more efficient / possible to run this kind of system on renewable energy as is currently available?
Yeah, so I guess it depends on what you consider, like what renewable energy you're talking about. Like if you're talking about natural gas, like renewable natural gas to provide heat to an absorption chiller, that makes sense, but it's also fairly expensive. What we're seeing in terms of renewable energy is that the temperatures that they operate at are typically not what you'd see from systems designed 50 years ago. So there's kind of like a holistic change you need to do within the building to be able to accept certain technologies that might be there. Far easier is like our new campus. It's much easier to integrate geothermal or solar thermal into our heating and cooling networks because we're building it from scratch and we can design it for those temperatures. Whereas the general campus or our Riverside campus, the temperatures don't make any sense. But the idea that we're working with here is that every system that we do replace, we're replacing it with the future in mind. So eventually when we replace the heart of the system, if you will, all those extremities are already built in size to take that temperature that would be there, that we can make beneficial use from it. I hope that makes some sense, but it's an iterative approach. I find in your existing building stock, it's really difficult to do it all at once. You got to kind of do it inch by inch, knowing where you want to be 10, 15 years from now, so that you're prepped and ready for that final solution.
Thank you. Sejal also had another question, said, is it true that the new civic expansion is not building renewable energy into the initially implemented energy systems? And why is that?
So we haven't, I shouldn't say that it's not, renewable energy won't be there. What I can say is that building will likely be the highest performing building in Ontario when it's built. So that entire complex is being designed to use low temperature hot water and leverage heat pump technology. So we know that healthcare, we need chilled water all year round. We need that cooling energy, but we're using that heat used to produce cooling to produce most of our heating at the same time. So that's an efficient use of technology. We do have some fossil fuel systems that will be there. Those are required. So our backup generation. So our backup generators will have to be natural gas or diesel to handle those loads. But what we've really tried to do with that new campus is design the building to use as little energy as possible, and then use that as our basis point to start filling it with energy. And the first thing we're using electric heat generated by the heat pump chillers to produce our heating. And the heating load is always bigger than the cooling load. And we're doing so much reclaim there that there's only a very small amount of energy that's required using a fossil fuel for your peak days. So those days that are your very, very coldest, where you have the most fresh air coming in that needs to be tempered, they will still be on fossil fuel. The idea, though, is that over time, we're able to integrate other technologies. Like today's technology isn't the technology that might be there in 10, 15 years, but the building itself is ready to accept those systems. And there's some really interesting stuff coming out in heat pumps. And although we're using heat pumps, there's some really cool stuff coming out that's in the research stages now that'll be absolute game changers, not only for a campus that's brand new, but an old campus like my own that might be able to extract that have this technology that can produce heat at a level where you don't have to change everything to make it work. So a lot of interesting things coming to us, I'd say probably the next decade.
Some thanks, Ron. So final question. Sejal said, I'm a resident at TOH, hence my question. Thank you for the webinar and your responses. Interesting to hear. Thank you so much for your question, Sejal. So final question from Lisa. She is wondering who's providing the grants for retrofits?
So we'll take money from anybody, frankly. So we deal a lot with the IESO. So there's a new program out there that makes it super, super easy for you called Biz Energy. So if you're looking for someone else to do all the engineering work, Biz Energy is the place to go. You have to have your systems installed by December 31, 2025 to take advantage of that. We've had 2 of our buildings assessed already. Riverside has like a year payback on its initiatives. So we'll be going ahead with that. We work a lot with Enbridge in Ottawa. So Enbridge has some great incentives for boiler retrofits, although they have to be condensing now. And then there's the where we have an old building where we want to convert a lot of our systems, General Campus, for example. We're putting together a deep energy retrofit package for that we'll go to market with and hopefully be able to extract some funds from or have a partner help us with the funding there. So either through the Canada Infrastructure Bank or one of its partners, or through others, through another partner that might want to participate with us to leverage the green credits that come with a large scale intervention like that.
Okay, so one more from Patrick, and then we're going to close it off. Question for any of the panelists. Ushed Rock has advocated for the role of chief heat officers in cities most vulnerable to extreme heat. What's your view on nominating chief heat officers in Canadian cities? Anna, do you want to answer one? I feel bad. There hasn't been as many questions.
No, I don't. It's actually no, don't feel bad. I think it's extremely important, but I think while heat is really important, I feel like it should be a chief climate office or chief planetary health office, something like that, that it allows them even at the mandate level, so they are not just focusing on heat, but they can also look at a deeper community level, so that it gives them a perspectives on justice and urban planning and public health and all of these other things. Because again, the more we compartmentalize, even as we're creating roles, the harder it is for us actually to create these transitions. So very important, but maybe potentially with a slightly different title. But I agree.
Yeah, I think that makes a lot of sense. There's a lot of different ways we could approach this, but I mean, at least it is being addressed. So, all right. Okay, so I think we'll close up there. If anybody has additional questions, you're totally free to reach out to myself or the coalition, and I can always pass on additional questions. The recording will be available and sent to all registrants as mentioned earlier. So thank you so much, Ron and Anna and Myles. Really appreciate your participation today, and stay cool. Okay, thank you to all of our attendees as well. Take care.